Hello friends, welcome again to my channel where we discuss the science behind this world of medicine. So today we are going to discuss about the important questions that you may have related to high cholesterol levels, or what we refer to as medically hyperlipidemia. So we will discuss a few important concepts about this high cholesterol levels. The first and foremost thing to know about high cholesterol levels are that your body does not give you any signals of high cholesterol in your blood. There are no symptoms, absolutely no signs or symptoms in your body which will indicate that your body cholesterol levels are on the higher side. So this is an important concept to know. But then how do we know that your blood cholesterol levels are elevated? Because high cholesterol levels have been linked as one of the biggest risk factors for heart diseases, or what we call as the cardiovascular diseases. So how do we get to know? So we need to do blood tests which are confirmatory for high cholesterol levels. The blood test I am referring to is the lipid profile. Lipid profile is the only confirmatory test for high cholesterol levels. Now, for a healthy individual, my personal advice, and as per textbooks of medicine, a healthy individual should get his or her lipid profile done every 2 years minimum. You can get it done earlier, but at least every 2 years you should get your lipid profile done. For an individual who is already having a heart disease, diabetic or hypertension or any other disease, or above 40 or 45 years, should generally try and get their blood tests for lipid profile done every 6 months. This lipid profile test is done on an empty stomach, and getting it done every 6 months, I believe, is not a challenge. So you should get it done every 6 months, irrespective of whether you feel healthy or not, for an individual who is comorbid or above 40 and 45 years. For people who are less than 40 or 45 and healthy, you can wait for 1.5 years or 2 years even to get your lipid profile done. Now, when you get your lipid profile done, your report comes with a few parameters. Now, how do you assess what is happening in these parameters, and what does each one of them, or what is the significance where you need to focus? So when you get your blood test done for lipid profile, you will see on the top will be total cholesterol, or it can be at the bottom also, which says total cholesterol. Then you would have TG, which is the triglyceride. Then you may have VLDL, which is very low density lipoprotein. Then you may have LDL, which is low density lipoprotein. And the final factor will be HDL, which is the high density lipoprotein. So this high density lipoprotein is considered to be a good cholesterol. Yes, it is a good cholesterol for the body, because HDL cholesterol helps in removal of cholesterol from the body. Because it is high density, it absorbs all the VLDL, TG and LDL into it and make it a high density lipoprotein, and helps it excrete through liver, through body in bile fluids. It gets excreted. It gets removed. So HDL cholesterol is a good cholesterol for the body, and generally speaking, the levels above 60 milligram per deciliter of HDL are considered good for your body, and lower than 40 milligram per deciliter are considered bad for your body. So yes, if your HDL cholesterol levels are elevated, it is good for you. However, that said, TG, which is triglyceride, VLDL and LDL are considered to be bad cholesterol for your body. And especially so LDL, which is the low density lipoprotein, is one of the worst cholesterols for your body. Why? Because LDL gets deposited in your blood vessels. Yes, the lumens that are carrying, or what should I say, the blood vessels that carry blood, the LDL cholesterol has a habit of depositing in these blood vessels. And what happens is, when the deposition happens, it may reach up to a stage where it may lead to a complete blockage of that blood vessel, so that the blood cannot flow further. If this happens to your blood vessels in the heart, what happens is, if the blockage is above 90%, if LDL cholesterol deposits more than 90% in that lumen, your heart has a reduced blood supply. Heart still has to do the same amount of effort, but it is getting 90% less blood than it should get. In that cases, what happens is, people land up in emergencies with a heart attack or a myocardial infarction. And when you run the tests, or when we run the tests for a patient reached an emergency with a heart attack or myocardial infarction, we generally may find that the cholesterol levels were super elevated. Super elevated led to deposition of cholesterol, more than 90% blockage, and the heart was not getting a good supply of blood, which is why it failed. Now, this deposition can also happen in blood vessels which are supplying blood to your brain, which is represented as stroke. It can happen in your lungs, in kidneys, and various other tissues. Sometimes what happens is this deposition gets removed, detached from its deposit place, and it becomes a ball within the blood. It flows like a ball and it gets impacted in smaller blood vessels where it does 100% blockage, which is commonly reported in medical emergencies as stroke, which is reduced or no blood supply for the brain. It is technically referred to as ischemic stroke, wherein the blood supply to the brain is completely removed. And this is an important, very critical medical emergency. So now you will appreciate the importance of high cholesterol levels in your blood. These are not good. You need to address them immediately. And yes, talking about triglycerides and VLDL, they are the precursors which lead to formation of more of LDL. So immediately they are not harmful, but yes, if your triglycerides levels are elevated, you can probably reduce your carbohydrate intake, or you can reduce your intake of food to reduce the TG level. But ultimately what shows the importance is this LDL cholesterol and HDL, which is a good cholesterol. Now that said, the important factor is how do you manage? You get a report done every 6 months or 2 years, you're getting a lipid profile done, and suddenly you see these levels elevated, decreased, whatever you see, what is the next step that you do? So if you're a perfectly healthy individual without any symptoms, signs, or any disease, and your cholesterol levels are elevated at up to 30% of the upper range. For let's say, for example, if it is 150 is the upper range of LDL and it is 30% above that, then you can relax and you can reduce your cholesterol levels by exercise, weight loss, and good dietary modification. Exercise and weight loss helps in excreting the cholesterol lipids from your body and hence reducing the cholesterol, whereas good dietary modifications like reduction of fried foods, reduction of trans fat in the diet, having good fiber intake diet helps in reducing the cholesterol levels in the blood over a long period of time. However, if these levels are more than 30% of the upper limit as per your lab report, then I would advise you to consult your treating physician, doctor, or anyone who is into the medical practice to know whether you need drugs, means medicines are required for lowering the cholesterol, which are generally statin group of drugs, or it can be modified through weight loss or any other non-medical regime. However, if you have diabetic mellitus, or you have hypertension, or you have any previous history of heart disease or any other symptom, then in that case you should practically consult your treating physician or doctor to know what you need to do for your lipid metabolism or for your lipid profile. In some cases, or in almost 99% of the cases, if you have any of the comorbid condition like diabetes, hypertension, or heart disease, a doctor would add a medicine for elevated cholesterol level as well as for normal cholesterol levels. Because of the severity of cholesterol that I just described you, severity of having high cholesterol levels, LDL in your blood, doctors generally don't want to take risk, and even if the LDL levels are within the normal range, sometimes doctor would tend to add a lipid lowering agent, statin, to a medication profile of the patient if he or she is having diabetes, hypertension, and a previous history of heart disease. So I would advise you to consult a medical physician or a treating doctor in that case. So I hope, friends, this information on high cholesterol levels and cholesterol was good for you and you could actually implement it, because we covered that your body does not give any signs and symptoms. You need to get your blood tests done regularly, and what is the importance or what is the risk factors of having a high cholesterol in your blood report, and how you can control it, or what you need to do as a management, that if you're healthy and less than 30% of the above level, you can manage it by exercising, weight loss, and dietary modifications. If it is above 30%, you should consult a doctor. And if you have a comorbid condition like diabetes, hypertension, and a heart disease, you definitely need to consult your practicing physician treating doctor to know whether you need a medicine regime to be modified with a lipid lowering or a cholesterol lowering agent or a medicine. So friends, if you like my video, please like, share and subscribe, and don't forget to watch my next video. Thank you.